Hello and welcome to the 2018 Fauquier County Protocol Update. The updates we're going to talk about today include TXA, or tranexamic acid, and this is for internal hemorrhage control, lactated ringers, fluid and electrolyte replacement in those who have low blood volume or blood pressure, phenergan or promethazine, the administration route is being updated, and Toradol or ketorolac, the dose is being changed. The first protocol update we're going to discuss is the administration of TXA, or tranexamic acid. Displayed in front of you is the medication reference as listed in the protocol update. TXA is an antifibrinolytic agent, hemostatic agent. It blocks effects of plasmin, thereby stopping the dissolving of clots by the body. It's indicated for internal hemorrhage control, and we have two contraindications: subarachnoid hemorrhage and upper GI bleeding. There are no precautions in the emergency setting, and side effects could be nausea, vomiting, diarrhea, or headache. We're giving TXA under protocol number 27 for injury multisystem, and as you'll notice, there is no pediatric dose. This is an adult-only medication. It is mixed 1 gram in 250 mL of D5W and is administered over 10 minutes. Displayed here is the injury multisystem protocol number 27, where TXA can be administered. TXA can only be administered by intermediates or paramedics. The parameters for administration are penetrating or blunt trauma with high probability of internal hemorrhage, a sustained pulse greater than 110 beats a minute, a systolic blood pressure that is less than 90 millimeters of mercury, and once again, the dose is 1 gram in 250 mL of D5W administered over 10 minutes, and we do not administer in pediatric patients. Pictured here is the packaging for TXA, which is 1 gram in 10 mL. And again, our contraindications are subarachnoid hemorrhage and upper GI bleeding. The next update we're going to discuss is lactated ringers, also known as Ringer's lactated solution or sodium lactate solution or Hartmann's solution. For the purposes of this training, we're going to refer to it as lactated ringers. Lactated ringers is a mixture of sodium chloride, sodium lactate, potassium chloride, and calcium chloride. It's used to replace fluid as well as electrolytes, and also can treat metabolic acidosis. We use it in place of normal saline to prevent hypochloremic metabolic acidosis due to the chloride ion that is present in sodium chloride. Lactated ringers is referred to in the medical sepsis protocol number 50, and the administration is based on an accurate Q-SOFA score of 2 or more. The Q-SOFA score, just as a refresher, is Quick Sepsis Related Organ Failure Assessment Score. It has 3 criteria, worth 1 point each. A score of 2 or more suggests a greater rate of poor outcome. The 3 criteria are presence of altered mental status, a respiratory rate greater than 22 a minute, and a systolic blood pressure less than 100 millimeters of mercury. If you have 2 of those 3, then it is appropriate to administer the lactated ringers. Okay, so once we've obtained our Q-SOFA score and it's 2 or more, we need to check the patient's perfusion. If the patient is normotensive, we're going to administer 1 liter of lactated ringers. If the patient has signs of hypoperfusion, we're administering 30 milliliters per kilogram over 30 minutes of lactated ringers. If you do not suspect sepsis, but your patient is still hypotensive and showing an altered mental status, administer 500 milliliter bolus of lactated ringers, and if no improvement, continue administration of 150 milliliters an hour of lactated ringers. Now, remember, when you're doing your sepsis assessment, don't forget the SIRS criteria. SIRS, just as a review, is the systemic inflammatory response factor. It includes temperature less than 96.8 or greater than 100.4, a respiratory rate greater than 20, or an end-tidal CO2 reading less than 32, a heart rate greater than 90, and a white blood count less than 4,000 or greater than 12,000 per microliter. And if your patient is coming from another medical facility and they have drawn blood, they may have that information for you. Another place in the protocol you're going to see lactated ringers is under the injury burns protocol, protocol number 22, and it is replacing normal saline for the fluid of choice for the Parkland formula. 0.25 milliliters per kilogram times the total body surface area in percentage per hour for up to the first 8 hours. Lactated ringers is great for fluid resuscitation, and anytime we anticipate giving more than 500 mLs of fluid, we want to go ahead and choose lactated ringers. The next protocol update we're going to discuss is phenergan or promethazine, and we are having an administration route update. The update is IM administration only, no IV administration allowed. The advanced provider, the intermediate, and the paramedic can administer 12.5 to 25 milligrams IM of phenergan for nausea and vomiting that is refractory to Dfrem administration. This protocol update does contain a dosing change, and the medication is Toradol or ketorolac. The dosing change is the IM and IV dose. IM is 30 milligrams, IV is 15 milligrams. The previous dose was 60 and 30. But as you can see, this is an advanced procedure, and again, ketorolac 15 milligrams IV or 30 milligrams IM. This concludes the 2018 protocol updates. If you have any questions, please contact Lieutenant Matthew Shields. Thank you again.